My name is Noemí Arguello. My topic, acute metrostatic induced crystalline neuropathy. Definition is a progressive illness used to disease or damage of the kidney which can eventually result in the kidney failure. Crystalline induced acute kidney injury is caused by the static intravitreal precipitation of crystalline which results in untruth. Most commonly it occurs as a result of chaotic uric acid neuropathy and fragility in the administration of hydroxysteroid and the heart probably soluble or at metrolyte, the heart probably soluble in urine.
Diabetic nephropathy involves hypertension and hyperglycemia-induced changes in multiple pathways that contribute to morphological changes in the kidneys. The glomerulus is a globular-shaped structure composed of capillaries that are actively involved in the filtration of fluid from the blood to form urine. With diabetic nephropathy, early glomerular hemodynamic changes include hyperfiltration and hyperperfusion, which result in microalbuminuria. Increased afferent arteriole dilation due to a dysfunction in the vasoconstrictive autoregulatory response contributes to increased intraglomerular pressure, which is associated with greater mesangial cell matrix production. Expansion of the mesangial area and early morphological change with diabetic nephropathy is caused by greater extracellular matrix deposition and mesangial cell hypertrophy. This expansion is associated with a decreased glomerular filtration rate and a reduction in the surface area for filtration, which marks the beginning of renal failure. As this process continues, the glomerular basement membrane thickens, and this may eventually lead to glomerulosclerosis. All of these changes in glomerular hemodynamics cause stress and strain on the kidneys, which, if left untreated, may result in renal failure.
Specific shapes under microscopy. So, if you know the shape, you can know what type of stone it is, and it will be of great help on your board exam because it will describe to you like the stone, like for example hexagonal shaped stone, it's like cysteine, rhomboid, it's uric acid, etc. So that's the topic of today's video. So these are the most high yield crystals for your examiner for life. So first we have the most common type of stones. So the envelope is the most common shape that you see in your life. You receive and send mail all the time. So calcium oxalate, envelope. Let's go to cysteine stones. They are hexagonal in shape. How do I remember it? Cis looks like 6. Okay, especially if you know French or Spanish, it's pretty close. We have the struvite stone. Struvite stones are bad, like really bad. The coffin, which is bad. Okay, the way I remember it, you can say struvite as worse. Last, we have uric acid. They are rhomboid in shape. The way I remember, uric acid, sometimes gout comes into mind. And in gout, the definitive diagnosis is to get joint aspirate, okay, to see these crystals. Okay, and if you see them, they are negative birefringent and they are elongated. So here, this is the most elongated shape, okay, in this stuff. So uric acid, rhomboid. So envelope, calcium oxalate. Hexagonal, cysteine. Coffin-shaped, struvite stones, the evil one. Rhomboid elevated uric acid. I hope it's simple because it is. Now it is. And please subscribe, give it a like. You can like us on Facebook, follow us on Twitter. You can support these videos on Patreon. I'll be grateful if you do that. But for now, enjoy the day.
Medication in medicine. Metrocyte is used to treat certain types of cancer. It belongs to a class of drugs and not anti-metabolic and works but slowed or stopping in the growth of cancer cells and suppressing in the immune system. We use low dose as anti-inflammatory and immunosuppressive active. Metroxate is through medication, the dosage and how often you take the medication are based on your medical condition and represent to treatment.
Metabolite class of anti-cancer drugs. Methotrexate can be given orally, IV, or what's called intrathecally, which is directly into the spinal fluid. Side effects of methotrexate are largely dependent on how the drug is given. When methotrexate is given as a pill, patients can complain of fatigue, low blood counts, mouth sores. Kidney problems can also be noted. When methotrexate is given IV, it's usually at quite a bit higher doses than when it's given as a pill. And side effects can lead to kidney damage or liver damage. When it's given intrathecally or directly into the spinal fluid, side effects can include nausea and also what's called arachnoiditis, which is really just irritation of some of the cells in the spinal fluid or lining the spinal canal and up into the brain itself. And that can lead to severe headache, really stiff neck, and fever. Other rare but serious side effects of methotrexate can include pneumonitis, which is an inflammation of the lungs, and kidney failure.
Pros and cons. Pros. More than half of people taking it 50% improvement in the course of their days. Is it effectively treatment of most people tolerate it? And cons. Metroxate can cause you're more likely to hit infection or may worsen any current infection. The use of high-dose metroxate as is cancer treatment carries a risk of significant neuropathy.
By using a regimen that included high-dose methotrexate with leucovorin rescue, the cure rate was improved to over 80%. So using this, which has now literally become a standard of care, more than 80% of kids with acute lymphocytic leukemia are cured. And then that further boosted the cure rate was only by changing how the methotrexate was given.
Use applied Ecuador. In the Ministry of Public Health in the recommended to use metroxate as freeze language route for the treatment of rheumatoid arthritis. The dose should be optimized with rapid increase due to 25 milligram per week and associated with in the take of folic acid. Conclusion. Acute renal failure occurs in approximately 22%. 22 received high-dose metroxate for the treatment of hematologic cancer. This can also show how renal failure can occur even in the Brexit or toxic metroxate level in plasma 24 to 4 He hurt after infusion for indirection and because the concentration of creatinine is zero than it broad marker of renal injury severity. The doctor tweeted that the prevalence of metrocycline use crystalline neuropathy might be underestimated. Thank you.